I actually didn't want to be a family medicine doc at first. When I was a third-year medical student, I thought I wanted to be a neurologist because neurology seemed prestigious and challenging, and they seemed to be like really revered in the hospital. I hadn't thought much about family medicine. It just wasn't something that people seemed to talk about near me, so I did a lot of neurology rotations at the end of my 4th year in my internship year, and I kept seeing people come in and we'd diagnose these complicated diseases, but every time somebody needed something to actually help them, like prescription for an NSAID or equipment, it was always go see your primary care doctor. So at the same time I'm doing all these neurology rotations, I'm doing all my hospital rotations and getting people in and out of the hospital. And during that, I met a guy named Tom. So Tom was about 50 years old, but he looked over 70. He would wear dark blue jeans, had a big belt buckle, black button-down shirt. He had a yellow-tinted, thickened, wrinkled skin on his hands and face from smoking and nicotine staining. He had a really wry, sarcastic sense of humor that made us kind of bond pretty quickly. And when I first met Tom, I was seeing him for pre-op evaluation for a 4-foot amputation. He was a smoker, did a little bit of drinking, and was getting, unfortunately, that amputation done. So I told him to quit smoking, right? Because obviously if he didn't quit smoking, it was gonna cause him even more problems. And I gave him some nicotine patches until he could get to his primary care doctor, because that's what we're supposed to do. But over the next 18 months, I kept seeing Tom come back again and again. First, we did his 4-foot, like I said, then we did a below the knee, then an above the knee. Then we went to the other leg and did a 4-foot, below the knee, above the knee. I kept seeing him in the hospital under those fluorescent lights with the hum of machines and the smell of orange cleaner and bad coffee, thinking to myself, why doesn't he quit smoking? Why isn't his primary care doctor working on that? And I talked to him about it, and he had a primary care doctor, but he didn't like to go because he just felt admonished. His doctor would say, fuss at him for stopping smoking or not stopping smoking and refill his patches, but nobody ever talked to him about addiction, about what to do for cravings, about treating the mental health issues that so often go with addiction. So one day, I'm walking down the hall toward the end of my internship year, and to go talk to Tom about his heart attack, because having all that vasculopathy in his legs, it's no surprise he's also got it in his heart. And I'm standing outside his room, feeling so frustrated because he's such a young guy. And it just felt like it was just so preventable. And I thought to myself, he doesn't need one more doctor at the end of the line here. He needed a really good primary to meet him where he was years before, to fight for him before the bad things happen. So standing outside that room is when I realized maybe neurology wasn't for me. I wanted to prevent this from happening. So Tom got his triple bypass, and he died a few months later, and I switched to family medicine. And I did that because people like Tom taught me that family medicine isn't insignificant. It's not small medicine. It is life-changing medicine, where we walk beside people through their journeys, where we meet them where we are, where we keep them out of the hospital, where we help them learn to take care of themselves. And I have done that for the last 20 plus years of my career, and I couldn't be more proud of the work we do as osteopathic family physicians. Thank you.